torsion of the gonads, torsion of the testis and torsion of the ovary. In boys, torsion of the testis. The testis can undergo torsion on its own axis around its own cord. It can happen most commonly in the undescended testis, and even in normally descended children, the testis can undergo torsion. It is very essential that the testis should be identified early to prevent necrosis and gangrene. The testis can die. The testis can lose its viability and it can die. It can result in gangrene. So it is very essential for the parents to identify the condition of torsion testis. Usually the children will present with swelling and redness of the scrotum. Usually the parents will think about that it is related to ant bite and they may ignore. The time is very crucial. So depending upon the torsion, the testis can undergo torsion on its own axis. It can have number of times, 1 time, 2 time or 3 time. If the number of turns are more, it can result in early ischemia and early gangrene of the testis. So it is very essential. The parents have to identify the condition and refer the child to the consultant pediatric surgeon as earliest as possible. Similarly, in female children also, the ovary can undergo torsion. It can result in gangrene of the ovary. The girl children may present with features of abdominal pain, lower abdominal pain and vomiting. First we will deal with the torsion testis. As you can see from the pictures, the testis, the scrotum is swollen, redness, and you can see during the surgical procedure, the testis has turned on its own axis and the color has changed to black in color. You can comparatively see on the normal side, the testis is red in color on the opposite side. So if the turns are returned and the torsion is twisted, if we return it to its normal position, if the testis retains its vascularity, we can retain the testis. Otherwise, the testis has to be removed. The main thing is we have to fix the opposite testis. The other testis is also prone for torsion and it has to be fixed. So the contralateral testis also has to be fixed. You can see from the pictures, the testis has gone torsion in these cases and resulted in gangrene. So in all these cases, we have to remove the testis. If the child is lucky enough and the child has been brought with considerably earlier, the testis can be saved. In torsion of the ovary, you can see the children with associated cyst in the ovary can undergo torsion, or the ovary itself can undergo torsion. It can happen from birth to at any age of age. Usually the girl children present with lower abdominal pain and vomiting. The scan has to be done and we have to identify the torsion of the ovary. Usually for girl children we do laparoscopy and we can correct this by laparoscopic procedure. You can see the twisted ovary along with black content. The cyst has also undergo torsion and the cyst alone is removed and the ovary is retained. Provided the child is brought earlier, the ovary can be saved. Also, the ovary of the opposite side has to be fixed to prevent torsion of the opposite ovary. To conclude, torsion testis, the parents must be aware of the important signs and symptoms. Any children who presents with redness, swelling on the scrotum, they must immediately refer the child to the nearest pediatric surgeon. If it is not operated, if the condition is not diagnosed or not operated immediately, the testis can undergo ischemia and gangrene of the testis. Similarly, in girl children, any girl children with presence of lower abdominal pain and vomiting, they must refer the child to the nearest pediatric surgeon and necessary investigation has to be done and proper treatment has to be given to prevent gangrene of the ovary. Thank you.